Hello and welcome to Kaweah Health's Community Engagement Webinar. Today's Thursday, June 23rd. My name is Deborah Volleson and I'm the Director of Community Engagement. I am joined, of course, by Gary Herbst, our hospital CEO, and we are, as always, ready to answer any questions that you may have about the happenings here at Kaweah Health. Gary, welcome.
Yes, thank you, Deborah.
Yes.
Good to be back.
Yeah, welcome to this hot, is it muggy? Hot and muggy
it
day
is,
today?
It is hot and humid. It's about a 3 block walk from my office down to the studio here, so you definitely warm up in a hurry, but I really appreciate Maria and you keeping the temperature in the studio nice and comfortable.
Yes.
And
so the rest of us freeze when we know that you're
I know,
coming.
I'm sorry.
We turn it way
yes,
down.
and thank you for that. Your
And
sacrifice.
Always. And most of the time you're running.
Yes,
And
as I
just
am
jumping
today.
in the chair.
Yes.
So we always appreciate the commitment you have made to our community.
You bet.
And so let's go ahead and get started. I know we aren't talking a lot about COVID now in the community, but we are still affected here at the hospital.
Yeah, I would say we're still talking quite a bit about COVID. It is still very, very active out there. Fortunately, these new variants, the BA.4 and BA.5 and BA.2.12.1 are the variants circulating throughout most of the country and the state and our county. Positivity rates are still rather high. Just a week ago, Randy Koka, our Director of Laboratory Services, told me that 33% of every patient we tested for COVID, whether it was in the ED, surgery, or as an inpatient upon admission, tested positive for COVID. That's pretty alarming. But fortunately, these variants definitely appear to be much more mild in terms of how they're impacting people or affecting them, feeling more like the common cold. But interestingly, I'm also talking to people that had COVID a year and a half ago and are still, feeling the effects of long COVID. 2 years still not getting their sense of taste or smell back. I was out rounding on our physical therapy clinic out on Lover's Lane, and one person was telling me that they'd had COVID and still 2 years later not able to smell or taste. So I'm sure that's very, very frustrating for them. We seem to I was thinking about how I might describe this. It feels like we've been on cruise control for the last couple months, but at a really high speed. So you can't take your eyes off the road for a moment. So we currently have 24 COVID positive patients that are in the hospital right now, and that has stayed at that level probably the last 3-4 weeks. We actually had dipped down to a single digit, but then it came back. I don't think any of those 24 patients are there might be one in the ICU right now and a couple on vents, but for the most part, when I've been reporting 24, 25, none of them have been in the ICU or on ventilators. So, but they oftentimes are staying for a pretty long time. I think it's still about 50-50 in terms of those that have been admitted because of COVID, that's their primary diagnosis, and the other 50% is they have COVID, but it's a secondary diagnosis. It's not really why they were admitted. Oftentimes that's so kind of difficult to know, did COVID cause this heart attack or this stroke or this pneumonia? But we very clearly try to indicate whether it's a primary or secondary diagnosis. One of those 24 patients is a 10-year-old child. So we have been, over the last couple of weeks, we have had usually 1 to 2 pediatric patients that are in the hospital with COVID. The hospital, when I say cruising at a very high speed, it's not really because of COVID, but we just continue to be an incredibly busy hospital. We had 18 patients that were holding in the emergency department this morning, waiting for a bed to open up, and if you count them as a inpatient admission, which we do, along with all our patients that were already in an inpatient bed, together that translates to an occupancy rate of 96%. So again, very, very busy. It really hasn't let up, and the number of patients that are holding in the ED, sometimes it rises to 20, 30, 40. I think our all-time record now is still 73 that we experienced back in May, the day that we called the internal disaster. So definitely at 18, it's come way down. Somebody asked, when's the last time that we experienced a COVID death? And sadly, just 2 days ago. So just on Tuesday, the 21st, we had 2 patients that died where COVID was their primary diagnosis. Where it's really impacting us the most is our already depleted and exhausted workforce. So definitely our employees are not immune to contracting COVID. In fact, we're pretty much learning that whether you're fully vaccinated, boosted, double boosted, it does not prevent you from contracting COVID. It still provides tremendous benefit from keeping you from being really sick or hospitalized or dying of COVID. But we're probably seeing just as many patients that are fully vaccinated as getting COVID as not. We currently have 79 of our employees, as of Monday, are out on a leave of absence because they tested positive for COVID. That means they have to be out for 7 days. That's the quarantine period. Although many of them feel great, or might just, again, have a cough or a runny nose, but they have to quarantine. That's the law for us is set by OSHA and the California Department of Public Health. So we already have 550 open positions. 200 of them are bedside nurses. We have more than 200 contracted traveler nurses here right now. So to have 79 of our own employees out on a leave, and unfortunately 6 of those 79 have been out since 2020. They contracted COVID early on in the pandemic, and I would say it's highly likely that they're going to return. They may be suffering from, again, those long COVID symptoms, or have just made a decision that they're not coming back, but they technically are still on a leave of absence. They're still a Kaweah employee, and we really hope they come back, but we're supporting them while they're away. None of our travelers have COVID right now, but we do have 5 of our providers, either physicians or advanced practice providers, that are currently out with a COVID leave.
And some of these are second rounds, third rounds. Do we have third rounds of COVID?
I have not heard third unless you have something to reveal to me, because I
don't.
know you're a second rounder.
I was a second rounder.
Yeah, I am hearing a lot of people have contracted COVID for the second time. I think I have heard some folks getting it a third time, and oftentimes they just have had the different variants. We had started with Alpha, we had the terrible Delta variant, and then the initial Omicron in the fall of last year, and then morphing into the different variants of Omicron, because the numbers I rattled off, the codes at the beginning of this presentation, those are all Omicron variants. So we haven't seen the return of the Delta. There's still the root virus is still the Omicron version right now.
So since you mentioned that about, whether you're vaccinated, boosted, people are still getting it, have we seen a decline in vaccinations? Have you heard anything about that? Last time I looked at the county website, we're pretty much unchanged at about a 57, 58% countywide vaccination rate. I know a lot fewer people decided to get boosted, including our own employees. We originally, when it became mandatory, except when you had a declination, we had about 1,000 of our 5,100 employees that chose not to get vaccinated, and more started to. But I think our all-time high from an employer standpoint, we were at about 83%
were fully vaccinated, but then when to be fully vaccinated, you now had to have that first booster shot. We dropped all the way down to 66%. So you can choose, even if you did get the original vaccine and you choose not to get the booster. You can do that. You can file a declination, although I've heard a number of hospitals are not allowing that. So you can't have got the original vaccine and then all of a sudden you have a religious objection to the booster. They're saying, I'm sorry, that doesn't work for us. So they're rejecting that declination. We haven't done that. Again, with just the fragility of our workforce right now, I don't want to force any employees to leave the organization. And so if you got vaccinated but the booster worries you and you don't want to get that booster, you can submit the declination and we will accept it at face value.
Right. So on the CDC's Twitter account, they posted that children as young as 6 months are eligible for the vaccine. Are we vaccinating infants here?
Not yet. I don't know if it's both Pfizer and Moderna have received the emergency use authorization to go down to that age level. We are not vaccinating any children under 5 years of age. So 5 years and older, we do offer vaccination, but nothing under 5 years. That very well could change. I encourage people to go to the myturn.ca.gov website, and you'll see there all of the available vaccination sites and dates and hours and those that are eligible to receive, whether it's the initial vaccine, a first booster, a second booster. All of that, I believe, is on that website for our locations.
Okay. And do you feel confident our studies out about the safety of the vaccine for infants?
I really haven't read them. Maybe I've grown a little bit weary, of reading so much about COVID. Certainly I did read just the articles that were in the local papers and the scientists, at the FDA and the WHO and the CDC, based on their trials, have determined that it's safe enough. Yeah.
Okay. So you mentioned earlier about the holds the patients that we are holding in the emergency department. So we've talked about this a couple of times, but social media, we're really pushing out social media about the impacted emergency department. And so we've kind of mentioned this before, but what is changing? What is changing that we have, why are so many people seeking emergency care?
Yeah, I'm sure it's multifactorial. There's a lot of illness that's out there in our community right now, and maybe that as society is opening up more, people are more active. They've become more active in the summer, so we definitely see the aches and the sprains and the broken arms. We are seeing a lot more trauma. Accidents, motor vehicle accidents, boating, just all kinds of trauma. So that really we've seen an uptick in that, and I probably attribute that to just more activity. Unfortunately, there's more violence out there in society right now. I think, again, people have become so weary of the pandemic and the psychological effect it's had on people. So and a tremendous amount of mental illness. Just a couple days ago, we had 22 patients in the emergency department that were suffering from a mental health crisis that they were going through. Zone 4, remember our ED has 73 beds, 5 zones. Well, Zone 4 was built specifically to accommodate mental health patients. So all ligature free, so a patient can't harm themselves in that room. But we only have 9 of them. And it's every single day, every one of those beds is full. and we're spilling over into the other zones. Our mental health hospital is full, and unfortunately we had an outbreak of COVID there, so that kind of reduced our capacity out there. But some of these mental health patients are staying 2 to 3 days in the emergency department, which then just keeps it perpetually busy. But the volumes have been really high. I was actually just a couple days ago. I was at our urgent care center on Ben Maddox and Tulare, and I want to give a shout out to all those folks. It's called Kaweah Health Medical Group Ben Maddox Clinic, and Dr. Quackenbush, who's a family medicine physician, he has a regular practice there where he sees his patients that have him as their primary care physician. But it's also a very quality urgent care center. And I think the name might be confusing people. Before it used to be called Sequoia Prompt Care, which people might think of more as a walk-in clinic. It was pretty empty, and they said their volumes have been really low other than just doing COVID testing. So I just really want to encourage folks that if you really believe that you don't have an emergency. I tried to cut off the tip of my finger about 4 weeks ago pruning some plants on a Saturday, and fortunately that urgent care center is right up the street. Fortunately, Dr. Quackenbush happened to be there, and he's able to cauterize it, and it's healing all nicely, but I would have much rather gone there than to the emergency department. I didn't consider it to be an emergency, and they can take care of a lot of different things. So, but what continues to drive the volume of patients to the ED, I just don't have the answer.
Mm-hmm. So when you're referencing mental health and the mental health patients, are those children?
They're both children and adults. Yeah, unfortunately, and you're all hearing about this as well. A lot of it had to do with the shutdown of schools and distance learning and the psychological impact that's had on our youth. And so yes, we're seeing adolescents and adults. And unfortunately, there's definitely a rise in violence. We've had, just over the past few weeks, we've had a number of our staff that have been attacked in the emergency department, to the point where we've been pressing charges and having these patients arrested, which is tough for us because we know they're suffering a mental health crisis. But at the same time, we've got to protect our staff. Mm-hmm. And it's really disturbing just to see that level of mental illness and the violence that oftentimes accompanies it.
So when we have mental health patients in the emergency department, so I know we have social workers here at Kaweah. So do we have assigned social workers in the emergency department?
Yeah, we have dedicated social workers in the emergency department that are trained. Working in the emergency department takes a really high skill. And I really admire and applaud the staff, the physicians, our staff that work in that environment, because it's much different than being up on a nursing unit, although that is very challenging as well. But just the diversity of the people that come through the emergency department. So we have social workers, we have psych techs or technologists, but we call them techs. And we have psychiatrists. We specifically have a position that's called a consult liaison. That is a psychiatrist that works with mental health patients in the ED, also goes up onto the units, because we do, sometimes the mental health patient will also be suffering a medical issue. They may have injured themselves, requiring hospitalization and treatment of that injury, but they're also still suffering through that behavioral health crisis. And then the county has a crisis stabilization team that is frequently in the emergency department, working along side by side with our staff with mental health patients.
Are we seeing a high turnover in our emergency department staff? I mean, you sign up to be a nurse, you sign up to take care of people, you're
Yeah.
not really prepared to have to sign up to protect yourself at the same time.
I know, and definitely these three female employees. I think a couple of them were nurses, another might have been a certified nursing assistant who was functioning as a sitter to watch a mental health patient. They were deeply traumatized by what happened to them, and there's a high probability that they won't come back. It is, again, it's a difficult environment to work in, so we do probably experience some of the highest turnover rate in the emergency department, as well as labor and delivery. Working on labor and delivery is very demanding, and again, just want to express my appreciation to that wonderful team. But those are probably two of the areas that we do experience the greatest amount of turnover, just because it's the intensity, of the work. And a lot of times, folks will go into the ED, spend a few years there, and they love it. They love the adrenaline and the variety of the work, and but then they kind of want to settle down a little bit, and so they might move to the ICU, which is also very challenging. But keeping them in the Kaweah Health family is
Right.
ideally, and having somebody that trained in the ED, got lots of experience, makes a great ICU nurse or ICCU nurse or that labor and delivery nurse. So,
Right.
but definitely our turnover, just as an industry, is probably at the highest level that we have witnessed in decades.
Wow, so it's probably not a good plug for an announcement I'm going to make, but I'm going to make it anyways. I sent the community engagement group, Ed Largoza, they're starting to do patient navigators. We've opened up a couple of positions called patient navigators for our emergency department. And so this came from Healthcare for Today and Tomorrow and the Emergency Department Advisory Council, telling our teams you need the host and hostess in
Yes.
there, to kind of help in the waiting room. So I sent everybody that job description, and we have the jobs posted. And so if you know of anybody who's looking to work in the ED, maybe they're not clinical, but it's a good service position.
Yeah.
It's a good way to help keep our patients not happy, but content in the waiting room if somebody's there kind of seeing to their basic needs before they see a clinician. So look in your emails, and if you know of anybody who might be interested in one of those positions, I put the link in to apply. So
you're probably cringing as I was.
you know what? I wasn't cringing because and probably everybody that's on this call today, they know the struggles that we have in that department.
Yeah.
And they know some of the things that we've gone through, but they know the importance of building the team.
Well, and I will say, the vast majority, a very high percentage of our patients, they're sick.
Yeah.
They're not feeling good, and so those that are in the waiting room, and oftentimes, if you're having a heart attack, if you're having a stroke, if you have, a penetrating wound or bleeding profusely, you're going right in. You're going right back to that exam room. You most likely came in by ambulance. But those that, aren't feeling well, and they're sitting in the waiting room, and they would love the comfort of a warm blanket and, maybe getting them some water, just checking in to see how are you doing. And that's really that patient navigator is to really try to make that experience a little bit more compassionate and positive, because it's awful waiting in the ED waiting room for hours and hours.
Yeah. And then a follow-up to the mental health crisis that we were just talking about. We're also partnering with the county to work on a pediatric crisis stabilization unit with Dr. Baga.
Yes.
And so I don't know if you have any updates on that. I know you meet regularly with the city and the county.
I actually, fresh off the press, yesterday I met for myself and Carrie Nowesky and Mark Mertz. We met with Supervisor Amy Sheklian and Tim Lutz, who is the Director of Health and Human Services for the county. And very excited that the county and Kaweah jointly submitted an application to the state to access some of the literally 100 hundreds of millions of dollars of funds that the state is making available for grants, specifically to support the expansion of behavioral health services throughout the state. So we were awarded $4.9 million that we will use to construct a new child and adolescent crisis stabilization unit. So those adolescents that are having a mental health crisis that are now coming to the emergency department for their care, if they don't have a medical reason to be in the ED, they can go straight to this crisis stabilization unit that is staffed with psychiatrists, psychologists, psych techs, that they specialize in behavioral health. Because if you come to the straight ED, there's only a few people there that mental health is, their specialty. So it's the rest of all the nurses and the emergency medicine doctors and who have training in mental health, but they're taking care of all kinds of patients. So focusing in a facility specifically designed for mental health will greatly improve that. We would like the next step is to develop an adult crisis stabilization unit for the exact same reasons, developing a child and adolescent, something that we would likely construct behind our mental health hospital out on Acres and Tulare. The problem is the operational funding. So we might be successful in getting the grant from the state to build that, but then the ongoing funding of it is severely underfunded. That the monies that flow to the county or flow directly from the state to us generally can't support crisis stabilization units, and so that's why you don't see many adult units. I think there is one in Bakersfield in Kern County, but I'm not aware of any others throughout San Joaquin Valley.
Wow. Well, more to come on that, because
Yes.
that would be fabulous. So we follow these shortages, and since the pandemic, it's been kind of crazy. Sometimes you go to the store and just a weird item's out of stock, but the shortages have kind of been challenging for the hospital.
Yes.
And the latest is baby formula, but has that affected Kaweah Health in any way?
Well, gosh, yeah, I've heard so much about it, and sadly, I just heard another infant just died by consuming formula produced by that Abbott manufacturing plant. So I don't know if it happened today or yesterday, but very sad because they just started producing again after they had been closed down for so long. So that's very disconcerting to hear that. Fortunately, we have not really had any problems when it comes to just regular formula, but some of the specialty formulas has been difficult at times to get. Nothing really major. We have been able to kind of work through it, but there are so many different baby formulas out there because children have all different kinds of conditions and allergies, and so you have to use a specific formula. It's not like it's generic and every child can use the same. So the basic formula we've been pretty good. The specialty formula can be hit and miss at times. It's definitely ebbs and flows from one product to another. Just here some of the examples. Lab collection tubes. When you go to get your blood drawn and they use the test tube, we're having a very difficult time finding those. Pre-filled saline syringes, IV solutions due to raw materials, transit and labor shortages. Hot and cold packs, again, material shortage and shipping delays. Suction canisters, sharps containers where we dispose of needles and again, shortages in materials and labor, and contrast for x-rays. That's hard to find. So we have an amazing team in our materials management department led by Steve Bajari. And so over the last 2.5 years, you remember what we experienced early on in the pandemic. We couldn't find masks, N95 masks and gowns and Those have become definitely more plentiful. But yeah, just a lot of just basic clinical supplies. But the team does a phenomenal job trying to find alternative products. So we work with the clinicians to, if we can't find this exact product, can it be substituted with something else? And so far, we've been able to make do. It's never resulted in any compromise of patient safety or the quality of care. We've always managed to be able to do that. I know, urinary catheters are commonly placed in patients, and they come in a prepackaged kit, all the things that you need to do to properly insert and a catheter and make certain that's infection free and so forth. We couldn't find them, and so we literally had a team of people one night that in a classroom were building the kits. We had the separate stuff that we could pull together, tubing and stuff like that, and so they were creating hundreds and hundreds of kits that we were making on our own. So definitely this pandemic has elevated our level of innovation and creativity.
Right.
Yeah.
And we're not alone.
No.
On the regional call, I'm the liaison for the hospital, and hospitals were sharing tips with each other, because we were all out of the saline, the pre-filled saline, and so they were sending out flyers. Here's the workaround around this, and so we're not alone in that. We're
No.
not alone in the emergency department. We're not alone in the census being super high. It's a trend.
Yeah,
that is
well,
everywhere.
I read your report. You do a great job summarizing.
thank you.
So I was reading your report just the other day, and I think it was not Clovis Community, but probably Community Regional Medical Center had reported they're at 120% occupancy. Now I know they're including their ED bed holds as well. It was reported that Fresno has 116 COVID admissions right now. So yeah, you're right. It feels the same up and down the San Joaquin Valley.
So talking about staffing shortages, a lot of nurses, we're hearing that a lot of nurses are leaving to become travelers. And so the question is, what is the mile range a nurse has to travel to in order to be considered a traveler?
Yeah, our policy is 50 miles, which is interesting. When last time I was up rounding on one of the floors, I met with a lot of travelers, and they'd be from Mississippi, Louisiana, Florida, wanted to come to sunny California, and that's what I've always typically thought of what a traveler is. Just somebody that was young, wasn't tied down, probably hadn't started a family yet, and just wanted that variety. And what a great life that would be for a while.
Yeah.
But now when I ask them where they're from, it's Bakersfield and Fresno. So that's what's been sad, is a lot of the employees, nurses at hospitals in Fresno and Bakersfield have quit to become travelers. They still live in those towns, but they commute to Kaweah as a traveler. So that's kind of unprecedented.
So what's the difference in a wage?
So I would say on average, what we pay the traveler agency is about 3 times or more than what we would normally pay an employed nurse. So an employed nurse is, probably going to make in the $50+ range per hour. But we might be paying the traveler agency up to $200 an hour for a critical care nurse or an emergency department nurse. So the rate we pay depends a lot on the specialty, that we're looking for. A medical surgical nurse traveler is going to cost less to us than an ICU nurse or an emergency department nurse. So that's the difference between what we pay the traveler agency and what we pay our nurse. Now, our nurse also gets full benefits. So, health and vision and life insurance and matching 401k plan, and that generally accounts for an additional 25 to 30% in cost. So you would kind of, and we don't pay that to the travel agencies. So they're responsible for the benefits of their employed staff. And so the delta kind of shrinks a little bit, but it's still huge. What we don't know, though, and I think they're forbidden to disclose this to us, is we don't know what the traveler agency is paying the nurse. So the traveler agency, I mean, their profits have skyrocketed. I think I just read that since the beginning of the pandemic, there's been, a 250% rise in the rate that the traveler agencies are paying hospitals. I absolutely am convinced that they're paying the nurse, the salary that they're paying the nurse is higher than what we're paying our nurse. That's how they're luring them away. But a significant amount of the payment we're making is going to the profit of the traveler agency. In fact, Congress is looking, with the encouragement of the American Hospital Association, is looking to pass a bill that would make it more transparent to us as hospitals to see the components of what we're paying these agencies, how much is actually going to the nurse and how much is going to the company, and to potentially limit the amount of profit that a traveler agency can earn during a pandemic. Yeah.
So do you, and I'm sure you don't, well, you have a really good memory, so how many nurses have we lost to traveler agencies?
It's hard to pin down because they don't always tell you.
Yeah, that's true.
We try to do exit conferences with our nurses, and oftentimes they're moving away because of a spouse or parents. But they'll say, I'm going to work for another hospital, which but they do. We do hear a lot. I would say during this pandemic, probably the most common reason for leaving was to become a traveler.
So how does Kaweah and the other hospitals, how do you compete with that? Besides the benefits, okay, you get benefits.
Yeah, it's hard. Just a sneak preview for our ambassador groups and our advisory committee members. So next Wednesday, we'll be presenting the budget to the board. That for the year that will start on July 1st, so fiscal year 22-23. And for the first time in our 60-year history, we are actually going to budget for an operating loss, a loss of $11.2 million. And the reason we're going to incur that loss is because we need to remain competitive. We can't. Two years ago, we were forced to freeze wages and to not make a contribution to our employees' 401k plans, and we raised premiums and out-of-pocket costs, and we had to do it just out of financial survival. But as you can imagine, it couldn't have been a worse time for us to do it while our staff is putting their lives on the line, and particularly this at a time when there were no vaccines and PPE was scarce, and so it was the hardest, most painful thing that we've ever had to do, but we had to do it. And so this coming year is more of our year of gratitude, expressing our gratitude to our employees for everything they've done over these last 2.5 years to give them a full pay raise that they earn, to match their 401k 100% of what they contribute. And we are freezing our health plan. No increase in premiums, no increase in deductibles or out-of-pockets of any kind. But at the same time, we still have 550 open positions that we're filling with travelers and overtime and extra shift bonuses, and we don't see that subsiding. It's not going to, it's not going to disappear overnight. And so it's essentially we're going to deficit spend in this next year. And fortunately, we've been a profitable hospital over the years. We've accumulated financial reserves that allow us to go a year or two, a bad year, which these last two have been bad years, and so we've had to use cash reserves, but it's unsustainable. You can't continue to do that. But the board felt that this was the right thing to do, and I fully support that, and I appreciate the board, their commitment, to our staff, and their recognition of the sacrifice and the hard work. Not that it makes it any better, but we're not alone. As I've talked to my counterparts at other district hospitals, Sierra View Hospital in Porterville, Washington Township Hospital in Fremont, California, all of them budgeting for pretty significant operating losses for all the same reasons that we are. So it's going to be a tough year that's followed, two previously tough years. But we hope that this is the year of recovery. We hope that things start to calm down and the workforce begins to replenish. We're excited about our relationship with Unitech College, a nursing school. Excited about the expansion that COS has done recently in providing more nursing slots. We look forward to the graduating classes. It's a great time to be a nurse. It's a great time to have a career in healthcare. It's still very rewarding and compensates at a very high level. We do expect that traveler rates will start falling. We hope to get back to the $130 an hour norm, but I don't think we'll get there quite yet. But it's going to be a challenging year, no doubt about it. And it's we can't take our eye off the ball at all.
Yeah. Okay, Gary, so we've answered the questions, and I'm just going to spend just a minute on some announcements.
Sure.
We've been pushing out our community engagement revamp, which is just it's just a push to get more members into our community engagement groups. We have 8 different advisory councils that meet monthly, and so if you see those ads or if you see social media, push those out, invite your friends to, or someone in the community who is interested in helping us with our local healthcare. That's what our community engagement is all about. And then next Thursday is our graduate medical education new physician resident mixer. And so we push that out to the group as well. And some of you are going to be there, and you're going to help us host these new physicians that are coming into town. And the whole key is to get them acclimated into the community so that they want to live here, stay here, raise their families, and become a part of us. So more information will be coming out about that as well. And just a lot, there are a lot of good things.
Yeah,
you were,
I was just, the last couple weeks, while every day is not fun,
right.
We did have a lot of fun. A week ago, Tuesday, we held our 7th graduation commencement at the convention center, and we graduated 42 residents across our 6 different residencies, and it was just a joy to see how excited all of them were, but sad too. A lot of hugging and tears between the faculty and our coordinators and the residents who've been here 3, 4, and even 5 years. And now, a number of them stay. We've been very fortunate that almost 40% roughly of our graduates over the 7 different graduations have decided to stay and practice in our community. And so that was a week ago Tuesday, and then this last Monday morning of this week, I got to welcome 47 brand new interns, and I presume that those are those that are invited to the mixer. But again, 47 brand new faces, Kaweah employees. While they're physicians, they're not yet members of our medical staff, but they are part of the Kaweah Health family, and they're fellow colleagues of all of us. And so, yeah, it was a very exciting in 2 weeks.
Well, and a couple of weeks ago, we kicked off the community hosting program for our new physician residents. And we got in a little late because some of them had already arranged for housing. So we have been able to place a couple of them.
That's what I heard,
But
yeah.
we are in, now that the process is figured out, thank you to Healthcare for Today and Tomorrow Committee, we're ready to roll on that for next year. And so we have people that are already signed up to host residents for 2023. So that's really
That's
exciting.
great. Yes,
yeah.
absolutely.
And but Gary, if you would like to end with some inspiration like you do for our employee huddles.
Well, again, just expressing our deepest gratitude to all of you. Next week will be New Year's Eve and New Year's Day for all of us here. I know probably not for you, most of us, the traditional December 31st and January 1st, but it is the end of our fiscal year on June 30, 2022. And so July 1st is the start of a new year for us. And I think all of us here at Kaweah hope that it will be a lot like that traditional January 1st New Year's, where we welcome in a brand new year, a fresh year, a positive year, and that it's just a completely great experience for all of us. So just want to thank all of you for being a part of it, and want you to have a wonderful weekend, and remind you that I will be gone actually for a couple months. So but I am going to have my acting CEOs and others from our executive team pinch hit for me. We want to continue to keep you well informed and answer your questions, and just stay engaged with you. So have a great weekend. Try to stay cool. I know that's going to be a challenge.